These are the things we're going to be talking about. I'm going to do a little demonstration, and I'm going to show what these things look like in real life through CDs and some videos. But this is kind of an overview of what we'll be talking about today. The first part are basically evidence-based treatments. I just want you to have that in your vocabulary in terms of looking for mental health treatments. It's just something that we look for as practitioners in treatments that we know are really effective. And so I'm just going to explain that briefly so you have an idea of what you're looking for if you have a child and you've got some concerns and need to find a therapist. A good therapist will know of evidence-based treatment, so that's something that's important. Another thing that we're going to talk about in particular is specific techniques that work for certain disorders, or behaviors rather. So there are quite a few interventions now, and the ones that we'll be focusing on today are some of those that will work on decreasing negative attention-seeking behaviors. That's just a big word for whining and tantruming and crying and all the things that you typically see a child do, right? So we're going to talk about that, and then we're also going to talk about core features of anxiety treatment. So you have an idea of kind of what that looks like if you were to bring your child to see a therapist, kind of like me. And since we talk a lot about anxiety here, it's good to familiarize yourself, if that ever comes up, for the type of treatment you would look for. The nice thing about interventions now is that we're finding that although we have interventions geared for kids that are 7 and above, and some for 2 to 7, what we're doing now is really fusing a lot of those treatments together. So we're teaching parents skills to help in treating kids at a younger age, which is great because that's the best time for change and that's the best time to be able to change behaviors. So we're going to talk about the really important role that you have in doing these interventions kind of on a daily basis now, which is really neat. So basically integrating different kinds of evidence-based treatments now to include parents is what we're looking at. So I know you all have this amazing group of children, which is why we're fortunate to work with you. And parenting is really tough. Kathy can attest to how tough I've seen parenting in practice. It's on a daily basis, it's much easier for me to think about and talk about, but when you're there with your child and they're having a fit, or they're whining, or they're crying for something that they say they can't do, but they really can, it's really, really hard to ignore some of those behaviors when you know they have the skill and the capability to do it. So I have 2 little ones. I have a 6-year-old and a 2-year-old, and I'd like to talk about the interventions that are out there that are really, really useful and practical on a daily basis. There's not a parenting manual, you already know that. It's really surprising given how much parenting advice goes on, but what we're going to focus on are the key interventions here again today of what is helpful in practice. So I think being a parent, but especially being a parent, I can imagine being a parent of a child with 22q can be extremely rewarding in many ways, but probably also equally challenging a lot of times. And so, there's a lot of medical symptoms associated. There's all these mental health concerns and behavioral issues, and your natural instinct as a parent is to protect your child when they're little, but kind of through lifetime, to just kind of scaffold them and help them and make sure they're successful at these things. And so one way of helping children, which we find, is being really informed and knowing what the language is around things like the special education system, mental health treatment, so that when you're looking for something and you're in the special education system where you're looking for a mental health provider, you know exactly what to say to them and what you're looking for yourself. So being informed is kind of being empowered, right? So you know what you're looking for and you're able to successfully advocate for that for your child. And the reason why we're talking about this again is that, again, we have a lot more treatments now that we know that works. And so knowing about these treatments will help you find one if you ever, it's kind of to put in your bag of tools. If you ever need it one day, you're ready and kind of armed to be able to talk about it. So what is evidence-based treatment? It really basically is treatment that has gone through different research studies time and time and time again and been proven to show really effective results for a variety of different symptoms. So we have great treatments for anxiety. We have great treatments for behavioral, acting out behaviors. They're basically treatments that we've developed over time that come in a manualized form. So any therapist who is trained and well-trained can purchase this off of the internet, can pick it up and go through the manual, talk about it with you, and really implement this in practice with your child. And so it has specific ingredients that we look for treating certain symptoms. Evidence-based means it's supported by research. And the pros of this is that they improve functioning pretty significantly over time within a very, very short time frame. So some of the evidence-based treatments, for example, that we have that are currently being developed and that we have out now for anxiety for younger kids, like 3 through 8 years, they can work within 9 weeks, which is a really short amount of time if you go every single week. And they can have really long-lasting effects, which is important. So it's just an important kind of recipe book or ingredient list for therapists to know of so that you can get reimbursed by insurance, so that it holds professionals accountable too. So I'm just going to point this out because this is actually located on a really great website called effectivechildtherapy.com. And it lists a lot of the evidence-based treatments that are out currently. So for example, you'll see cognitive behavioral therapy is a key treatment that we've developed really well over time. And it's available for anxiety, for depression. Behavior therapy is really key. It's important for different types of symptoms, but kind of oppositional behaviors, you know, the whining that we were talking about, dawdling, taking a long time to do things. And so we know these types of treatments work really well for these symptoms. So I'm going to focus today on a particular type of behavior therapy and also anxiety treatment, particularly cognitive behavioral therapy, and talk about that. So I've given you handouts, kind of the basic handouts on what we would look at for parent-child interaction therapy. And this is basically a treatment that we have out now. It's been around since the 80s. And it really works very well on kids between the ages of 2 and 7, or kids who are older but developmentally within this range. I'm also going to talk about cognitive behavioral therapy. And then I'm going to talk about how we're currently really fusing the two together. So there's more of a parent involvement in treating anxiety symptoms, which is really neat. So they're basically just a set of tools, a way to think about parenting differently, but that we know works really, really well. And I'm sure you all do these things at home already. When I flip to the next page and you see the front cover of the Pride Skills, you're going to think, I do this all the time at home. But there's actually a very specific way to do it that we don't realize we're not quite doing it a certain way. And so coaching around this and working with a therapist is extremely helpful with this. So PCIT is basically a skills building program. And the focus of PCIT is to improve interactions between parents and kids. And like somebody had mentioned, you just get into this pattern sometimes where you're both working together, but not working together in a way that's as optimal or successful as you could be. It improves child compliance, it reduces disruptive behaviors, decreases inappropriate behaviors, decreases parenting stress, it improves family functioning, and it really generalizes to siblings and family members. So at home, we try to do this quite a bit because it works really well with little ones. You can see siblings doing this with each other and using specific phrases to really promote the behaviors that you want to see at home. So it works with a lot of different, it works with adults, it works with everybody. So, but there's 2 phases of parent-child interaction therapy. And the first phase is really key. And the first phase involves working on a child-directed, child-led portion. And you're probably thinking at this point, why do I have to let my child lead what we're doing, right? But it's really important because if you think about it, kids don't have a lot of control in their environment. Anxious kids really don't have a lot, or they perceive not having a lot of control in their environment. And so we pick them up from school and we ask them a zillion questions about how their day went. Who'd you play with? What'd you do? What'd you have for lunch? What'd you do in class? and they don't have a lot of control over what's going to happen and what's happening kind of currently. So this phase of treatment is really nice because it really lets them just take the lead. It sort of removes you out of being in control just during this phase and just practicing 5 minutes a day, because that would be terrible to do that all day long. But it lets a child take control, and it's really important for kids who tend to have anxiety symptoms. The first phase of treatment really helps parents learn about the PRIDE skills, and the PRIDE skills are what's listed on your first page there. We'll go over it on the next page. But what happens during a few weeks, every week, is that you have 5 minutes of homework every day. Just 5 minutes. You just have to work on these skills every day and do special playtime with your child and use these skills. And usually by the end of the first half of treatment, just using these skills alone, behaviors like whining, noncompliance, dawdling, taking forever to get something done dramatically decrease. There's a second phase of treatment. So those behaviors decrease usually by the time you get to the second phase. But the second phase is more the parent-led interaction, where the parent is, using things like timeout, using, removal of privileges, some of those behavioral things that we know work, and being coached around that. And the next part is that you need to just successfully pass the first phase before you get to the second phase. So this is all basic components of behavior therapy. So the first phase, which is on your handout, just for you to take home and kind of look at, and again, this is much easier when you think about it than when you do it in practice, is the P for PRIDE is praise. So it's really important to praise your child, obviously, right? We tell them, good job, hey, nice work. But there's a really specific way of praising so that you can actually describe what they did really well, very, very specifically. So you're defining what language you're looking for. So for example, good job picking up the clothes off the floor and putting them in the basket. Good job brushing your teeth and then getting your PJs on. So there's really, really specific ways to praise. And that's something that you work on typically in PCIT. So those things, it adds the warmth of the relationship. It really strengthens the relationship. And it works on that during that phase. The second part is reflecting, so reflecting a child's talk. And this is very helpful too for kids who have speech and language articulation issues, speech and language delays, because you're not necessarily asking them what they said, but you're more just kind of reflecting and let them know that I heard you and that I'm listening to you and that I heard what you said, and kind of clearly articulating what they said. The third part is imitation. So imitating a child's appropriate play. So kids kind of think the world of their parents, right, for the most part. And imitating a child's play means a lot to them because here's a parent who they typically admire, or they admire all the time, imitating what they're doing, which is really important. The fourth part is description, so describing appropriate behavior. So labeling, this is a nice example where you can help label feelings if your child's getting really frustrated or really upset or anxious or nervous. Identifying, oh, you look like you're getting kind of worried. I can tell because you're looking down and you're looking away and you're kind of moving closer to me. And those are ways of describing what they're doing, kind of giving them this internal language and internal dialogue of what they're doing. And it helps them to pay attention more. It helps them to develop more of a language around these things. And the last part is basically to enjoy what you're doing when you're doing these skills with them. So the second phase, the second part of the first phase are the child-directed interaction phase. There's additional rules around that. So actively ignoring inappropriate behavior. So that would look like completely turning away, keep on doing what you're doing, having a great time in your play, and completely ignoring the whining and the complaining or the tantrums or whatever it is that they're doing that you're trying not to pay attention to, which is really hard. So ignoring the baby talk, ignoring them when they're upset, telling them, I see you're upset, but if they're getting so escalated, you can tell them, well, when you calm down, then we can play again, and just completely kind of ignoring that behavior. ignoring clinging, whining behavior. In this phase, you're also avoiding commands. So pick up the blocks, pick up your shoes, do this, do that. You're trying to avoid it just in this phase. You're avoiding criticisms. So that's terrible. You probably wouldn't be inclined to say that, but really avoiding some of those criticisms, because this part of treatment is working on enhancing the relationship and working on all the positive skills. And then avoiding these 5 key words. So if you can think about how often you say this in a day to a child, don't do that. Would you stop? Stop it. No. So those are all things that we're naturally inclined to say. But just during this phase, during the 5 minutes of playtime each day, that's when you would try not to say it, because you're going to replace that with other things that you can do instead. So you should be forewarned that whenever you try to do something new with your child, all the behaviors are going to go like way up here, right? They're going to be just out of control in some ways, not so that you can't manage it, but worse than they typically were. But it's a matter of sustaining these skills over time. The second part of, so actually, you know what? I was going to do demonstration. So I'm going to do a demonstration of what the pride skills look like real quick. I'm going to have 2 people set up here. I'll have one of my colleagues, I think, be either the parent or the child. And if somebody wants to volunteer to pretend to be one of their kids, that would be great. So I'm going to have you set up here and do some playtime. So anybody. What's that? Okay.
All right, what do you want to do?
All right. So you the kid or you the parent?
I'll be the kid.
You be the kid. Okay. Okay, who's going to be the parent? Kathy, can we read it? So Kathy's going to use her pride skills, and she's going to be, they're going to be building something together, and she's letting Tony take the lead.
Okay. How old is Tony?
How old are you? You're 7.
7.
You're 10, but you're 7.
I just want white ones.
Can't wait to see what that's going to be.
Fit.
Oh.
Make it fit.
So that's a nice description. So this is a nice opportunity for Kathy to say, oh, you look like you're getting really frustrated. I can help you if you want. Want to try that?
You're frustrated. I can help you. Would you like some help?
So she asked a question. Even though she's a professional, has an MD, she asked a question.
Boom. Oh, I couldn't do it either.
So Kathy can model getting frustrated here.
Try it again.
Oh. Maybe this one's broken. Oh. Nice teamwork.
Great praise. So these are just kind of all examples of how this would look in treatment. It would be somebody coaching a parent and a child to go through these different
4
types
white
of
ones there. Yay.
Fun.
Great.
Blue.
Awesome. Thanks.
Did well?
Yeah, that was great. So she's lots of praises. Thanks. So she's lots of nice praises. Again, these skills they're hard to use on a daily basis. So there's a second phase of parent-child interaction therapy. It's how to, instead saying no, don't, not, stop, and quit, how to basically give your child a really specific command. So instead of saying, don't do that, or can you get up, asking a question, it would be more specific, like, please keep your hands off, or come pick up your toys. So that part works specifically on commands. You have a child comply, and then typically you praise. It also works on how to do timeouts effectively. So timeouts, mind you, are not to use during anxiety-provoking situations or when you feel like your child does not have a particular skill. That's not the best way to do timeout. The best way to do it is really if they're not complying with a specific direction that you're giving them. So I just want to emphasize that here. So you would give a command, you would count and show, because it's helpful to show. Count to 5, give them a couple choices, and then go to timeout. And then you follow that through with another command after they're able to comply with the initial command and come out of timeout. But those are all things that you really work on in treatment with a therapist and coaching around some of those things. So there's a nice parent role that's implemented with different versions of anxiety treatment for cognitive behavioral therapy. And parents' role is to really praise kids for positive behaviors. So you can see where that praise comes in. Praising kids for brave behaviors, even if they don't do it perfectly. So doing it kind of in increments. Giving effective commands, that's another key component of the anxiety treatment protocols that are being developed now. Differential reinforcement, so ignoring negative behaviors, but paying attention to brave behaviors, or those that are really, the child's able to do that they were normally anxious about. Modeling coping strategies, so you can see how Kathy was, oh, I see you're getting frustrated, and labeling feelings and showing children how to cope in certain situations. And then reducing accommodations, so trying not to providing the assurance, but not to the point where that's the only thing a child will depend on. Another key part of this is encouraging the child. So oftentimes when you're in an anxiety-provoking situation, your natural inclination is to just avoid the situation and it'll go away. But then you lose out on all these opportunities where you learned that you could have been brave and successfully done something. So there's different types of anxiety treatments now. There's parents being coached for anxiety treatment with younger kids between the ages of 3 to 8. And it works really well. It works in reducing symptoms in about 87% of kids, even a year later. And then there's traditional cognitive behavioral therapy, which is mostly for kids ages 7 and up. The tough part with cognitive behavioral therapy for kids 7 and up is that there's a lot of language requirements involved in this. It requires children to kind of sustain their attention and pay attention to a particular goal they have in mind. So there's a lot of difficulties if developmentally a child is, say, 8, but really is behaving more like a 6-year-old. That's where you might look more at a parent coaching model. These are basically the types of interventions that are being developed now and that are out now. They've been out for, I think, about a year now. And some that are currently being developed to help modify PCIT to include some of that cognitive behavioral therapy. So therapists would coach parents on how to help their kids not avoid anxiety-provoking situations and praise them and reinforce them for their brave behaviors. So these are the different types of treatments they have now. And if anybody's interested, I have several articles that are I can forward to you if you have a therapist in mind who are interested in these types of things. And the last part here is cognitive behavioral therapy for different ages. There's these different kinds of programs, Coping Cat, the CAT Project, and Camp Cope a Lot. These all work well for kids who are a little bit older. And a parent or a therapist can access this information and obtain this to use with their child. So in summary, there's a lot of really appropriate treatments that we have out now for behavior and for anxiety, and we're really integrating them now to use for anxiety treatment, which is really nice. So we talked about behavioral treatment, particularly PCIT. I showed you a clip about anxiety treatment, cognitive behavioral therapy, and now we're really fusing the two. So knowing about these and kind of having them in your vocabulary when you approach a therapist will be important, because if you know about these and you have a good therapist, they should be able to use them. Okay?